Hi, Carol. My name is Laura. Thanks for coming in my office today. How are you?
Good. Thanks for seeing me today, Laura.
Okay. So, I know that you came in to see the doctor, and he asked me to come and support you. He said that maybe you could use a little bit of a support. You had come in to talk to the doctor. Can you tell me what about?
I came to see the doctor about anxiety medication,
Mhm.
and he didn't want to give it to me because in my history, he notices that I've been drinking, and
Mhm.
he didn't want my alcohol use to get involved with the medication.
Mhm.
Um, so he decided that I should talk to somebody, and that's when you come into the picture.
Okay. So, tell me more about your anxiety. How is it impacting your life?
My anxiety started to increase over the last couple of years after COVID.
Hmm.
Just, you know, being at home with the kids, them having to do school at home, trying to get my own job, my husband's job, everyday activities. Um, it just kind of spiraled after that. And that's kind of like I started to drink a little bit, and so I'm trying to cut back on that, but I feel like the anxiety medication would help me because it just seems like when I wake up in the morning, I get anxious because I
Mm.
know throughout the day all these things that I have to do.
Okay. So you're experiencing a lot of stress, not only from your own job, but trying to manage the household. And
Yes,
you've been kind of drinking a little bit in the evenings,
yes,
to help reduce the stress.
yes.
Okay. And what kind of symptoms are you feeling for the
Like
anxiety?
heart palpitations, like sweaty.
Hmm.
Um,
Yeah.
uh, no, not really any headaches or anything, but just that nervous feeling that you get.
And that must be hard for you.
hmm
You work full time?
Yes,
What do you do?
I'm a secretary at a electrical company.
Hmm. Okay. So you asked the doctor for some medication because you were feeling anxious.
hmm
And he said that he noticed in the record that you had been drinking. How long have you been drinking?
I want to say it started probably right around the COVID time when everything started to, everything just started to change.
Yeah.
It was something from what me growing up that I've never experienced before.
Yeah.
Just everything being shut down and, trying to make sure my family had food. Being the sole person going to the store so nobody else would get sick.
Mm.
um, Going to the store and maybe not finding what I need to feed my family, standing in lines, and it was just a whole new thing. So I think that's where it pretty much started.
So it was a really hard time for you.
Yeah, and not knowing if my husband's job was going to be affected. Um, so um, I was lucky enough that my work was able to do it remotely,
Oh,
because I'm a
nice.
secretary.
Mm-hmm.
So, because they still had to keep going the company. So I'm lucky I didn't lose my job or anything, but trying to be at home, managing my job, and then all of a sudden your kids can't go to school. So all the kids are at home and they're on their Zooms.
Mm-hmm.
And, my husband worked for a trucking company, so he had to go to work. He
Oh,
wasn't remote.
right.
So, because that whole industry he works in started to increase because of everybody wanting to order their food and products
Oh,
online. So the semi industry really got busy. So he didn't have a problem with work, but I felt like I got the brunt of all this stress on me, trying to manage everybody.
so you were the one at home working remotely, and the children were home working remotely. And have you since gone back to work?
Yeah, everybody, everything started to open up and the schools went back and stuff, and
Mm-hmm.
I went back to work, but I just felt like that anxiety never got lifted. I
Mm.
feel like it just, that was like the base of it. And then, because like I said, I started to drink and then I started to drink more. So I
Mm-hmm.
felt like, it just became a habitual thing every
Okay.
night that mom's going to have, a couple glasses of wine every night.
Okay. So you're drinking some wine in the evening after you're done with work, and how is that helping you?
I feel like it relaxes me.
Okay. How much are you using? How much are you drinking?
Probably like 3 or 4 glasses a day.
Okay. Is that in the evening?
Yeah.
Okay. So you don't drink during the day.
No.
Okay. So when you get home from work and you're all the way home, settled in the house, then you will drink some wine.
Yeah, when I start cooking dinner or stuff, something, I'll just start preparing dinner and already have a glass.
Okay. Will you drink the wine and then eat dinner and let the kids eat, or do you sit down with them?
I won't sit down with the kids with my dinner with a glass of wine
Oh.
because, like I said, I'll have a glass, or two before while
Mhm.
I'm preparing it,
Oh.
and then when dinner's done or whatever, and there's cleanup, and then I'll continue maybe having another two after that.
Okay. Well, show me what your glass looks like, the one that you use at home to
It just
drink.
looks like your traditional wine glass, and it's usually half full.
Okay. So it's 5 ounces
Well, a
or
glass, the wine glasses I have are like this big, so I want to say it's about half. So I wouldn't know how many ounces. I know there's
okay.
probably this much left in the bottle,
Okay. Okay. So
and I
three to
really
four.
don't know how many glasses are in a bottle of wine.
Okay, so it's helping you relax in the evening. You're still making it to work the next day, but you're feeling a lot of anxiety the next day. Okay. So you asked the doctor for some anti-anxiety medication, and he thought maybe it would be helpful to cut back on the alcohol.
Yeah.
Had you talked to the doctor about that?
Yeah, I don't really know the whole medical thing as far as
Mm-hmm.
like what the alcohol does to the medication,
Mm-hmm.
but he told me it's his recommendation that I
Mm-hmm.
need to, cut back on the drinking because he doesn't, he wants me to be safe, I guess, so.
Right. Well, I think what the doctor might be saying too is that sometimes the alcohol use can contribute to the anxiety.
Okay.
And so by cutting back on the alcohol, maybe that would help reduce some of the anxiety. Tell me what kind of things do work for you to help you, kind of reduce or manage your anxiety besides the alcohol.
Well, I was exercising, but then,
Oh,
with COVID, everything shut down. So,
okay.
like I said, that's where my drinking kind of came into play.
Mm-hmm.
So now I feel like I left my gym membership, even though during COVID, they suspended everybody's monthly payments.
Mm-hmm.
But then once everything started to open up, they said, we're going to have to start charging everybody again. But everything had stipulations. I didn't want to get on a spin cycle with my mask on. I just didn't feel. I'm
Mm.
one of those that I want to, when I'm doing those kind of activities, I want to go back to normal. So when things started going back to normal with that, I just never renewed my gym membership.
Oh, you haven't been back to the
No,
gym.
I haven't been back to the gym.
Okay. Is there anything else that helps you manage your anxiety?
Going for walks and stuff like that,
Mm.
but my time management is just not there with that stuff because me coming home, trying to get dinner ready, helping with the kids,
Mm-hmm.
their activities, their homework,
Mm.
it's just I just feel like I'm overwhelmed on certain days.
Okay, so you have a lot to do all day at work, you have a lot to do in the evening, and sometimes you feel overwhelmed,
Yeah.
and the wine helps with that.
Yeah, but like I said, that's why I went into the doctor's office wanting to get some medication because I think maybe that would help me better than, drinking all the time. My
Okay.
husband made mention that, you know, um, seeing the bottles of wine in the recycling bin every week.
Mm-hmm.
So, you know,
Oh, he mentioned something about the drinking.
yeah,
What did he say?
he said that I should really watch my drinking because he's been noticing the increased bottles in the recycling bin.
Is your husband drinking as well?
No,
Okay, so you just have your glass of wine in the evening by yourself.
yeah.
Okay, so you mentioned that you thought earlier that about cutting down on the drinking. What would that look like? How would
Maybe 1 or 2 glasses of wine instead of like four, which
Okay.
I can't really say three
Mhm.
because it just seems like it's been four.
Okay. Okay. And that's daily.
Yeah.
All right. So you're thinking that it's possible that you might be able to cut back to half the amount of alcohol that you're drinking in a day.
Mm-hmm.
Okay. How would you do that?
Just just not doing it. I mean, making a mental note of it, watching myself.
Okay, so actually maybe trying to just tell yourself, I'm going to have 2 glasses of wine.
Yeah, and then when I go to the store, not buying those extra bottles, just buying what I
Normally
think I should
would.
be drinking.
Okay. And do you feel like you have support with that?
Um, I think so with my husband, yeah,
Hmm.
because if he knew, now he's, kind of upset that my drinking increased. So I think, he would be helpful to me and supportive of me if he knew that I reduced the bottles of wine I've been drinking.
Okay. Do you feel like the drinking is impacting your relationship with your husband?
Slightly, but nothing major. Luckily,
Okay.
I'm glad he's there for me right
Okay.
now.
So he is supportive and he's not really drinking himself and he really didn't pay attention to how much you were drinking
I don't think he
until
really did.
yeah, you said he just mentioned it recently.
Yeah.
What, in the past couple of months?
Mm-hmm.
Okay. And did he say anything else about the drinking?
No, just that he
Okay.
thinks that I've been drinking too much.
Okay. Oh, he actually said he thought
Yeah,
you've been
because with
drinking
the
too
amount of
much.
bottles in the recycling bin, so
Right. Okay. So let's kind of go back to what you said about the cutting back. You said you think maybe you'd be able to cut back on the wine. How would that work on the weekends for you?
um well, I don't drink during the day, so
Mm-hmm.
and the weekends are a little bit more of a relaxed environment because I'm not working,
Mm-hmm.
and the kids aren't in school. The kids still have their activities and their homework, but it's not that stressful, you know kind of day.
Okay.
Luckily
So
for
yeah.
me, I don't my job, usually what I do at work stays at work. I don't have to carry anything at home to
Okay.
do.
Mm-hmm.
So, that's a plus. It
Mm-hmm.
was just that whole transition. Um, your life turned upside down, and then you got to find a new way to adjust to the new life.
Mm-hmm.
And, it has gotten better. So, that's, like I said, that's where it all kind of intertwined.
Did you find it more stressful when you went back to work and tried to
Yeah, because a lot
reestablish
of
that?
everybody has a different view of things, coworkers and whatnot,
Yeah.
and the schools, they had you know different things for the kids to do and not do.
Mm-hmm.
So trying, because again, it was a whole new thing for everybody.
Right.
Now it's like kind of back to normal, but it's still out there or whatever. But I feel like now it's gotten better, but yeah.
Okay. So let's see if we could maybe make a goal around the drinking. Um, you said that you would like to cut back on the drinking. You know that it's been impacting your relationship with your husband a little bit, and also that you're feeling anxious, a little bit more anxious in the mornings than you
Mhm.
were before.
Mhm.
And I know that COVID had a lot to do with it, but now that we're out of COVID, you've started to readjust to going back to work, and the kids are back, and everything has kind of gone back to normal. So,
I think it just increased because it's like that
yeah.
habitual, that
Hmm.
addictive.
Hmm.
That's the only thing I can, think of.
Right, right.
That I,
A habit
yeah,
of
more of a
drinking every
habit
day.
forming. Yeah, because it
Right.
didn't start out like that. Now I feel like it's increased.
So you've probably been drinking a little bit more in the evenings ever since COVID started?
Yeah,
Okay, so about 3 years.
yeah.
And before that, you just drank socially?
I just drink socially.
Okay.
So when it started, it was like maybe a couple times a week, and then it kind of gradually increased over the years
Yeah.
to like almost every day.
Okay. And now you're drinking daily.
Yeah.
Okay. So if you were to cut back, what could you do in place of the drinking? I think that might be a nice thing to think about. Like, what could you do in place of the drinking?
In place of the drinking,
Yeah, something at home that could.
well, I could see decreasing my drinking. I would try not maybe drinking on the weekends,
Hmm.
because that would free up more time for me to do, something else. It's just real hard right now to put
Hmm.
me first because I have kids and whatnot, and
Hmm.
trying to take care of the daily household things. I would think about revisiting the gym membership maybe.
Oh, okay, that's a nice idea. So if you did the gym membership, what days would you go? What days were you going before?
I was going in the morning before, I would wake up in the morning because my husband was still home, getting the kids ready or whatever. So I would go to some early classes
Mhm.
and then maybe go to a night class once or twice a week at night.
Okay, nice. So that might be an idea is that the nights that you go to the gym membership, that would take the place of the drinking in the evening.
Hmm.
And you could do that maybe 2 nights a week, you said possibly.
Yeah.
Okay, and you would do that early in the evening when you got off of work? Like
I think
what's
the classes start like at 7.
okay. Okay. So you would come home, get the kids dinner and then head over to the
Hmm.
gym?
Hmm.
All right. And what days a week would you like to do that?
I could probably do it Tuesday or Thursday.
Oh,
And
okay.
then I would talk to my husband again about if I can go back in the morning. In the morning time, I would do it was like an open gym where you can walk.
Oh,
It
okay.
wasn't there was no exercise programs at that time because they were so early in the morning. It was
Hmm.
just the track was open for walking
You're
or
going to do it
running.
7 a.m. or 7 p.m.
I was probably gonna do it
the
the
evening?
walking. I would start at 6.
Okay. And then what about in the evenings?
The
Any
evening, the classes I would like to take her at 7.
Oh, okay. All right, great. So, um let's think about that goal of maybe going to the gym 2 nights a week for the class. And I'm going to ask you on a scale from 1 to 10, 1 being very low, 10 being the highest in confidence. So low confidence all the way to high confidence. How confident are you that you're able to go to the gym a couple of days so that you can cut back on the drinking?
I'm pretty confident.
So 1 to 10, where would you be in there?
Probably a 6 or a 7.
Oh, that's great. Okay. So that's a really good start. Possibly taking those nights and going to the gym instead because you wouldn't have a glass of wine before you went to the gym, would you?
No.
It just wouldn't work well for you. Okay. And what other things could you do to help you kind of manage that anxiety that you've been feeling in the morning?
Mm,
Is there any kind of adjustment you can make to your schedule? Anything that would make things a little less stressful for you?
I could try and think of some stuff, but right now I'm not really.
Okay, okay. Do you think it would be helpful to maybe talk to someone about some coping skills that would work for the anxiety?
I could probably visit that to have somebody tell me things to help me
Yeah,
because the
right.
only thing I can think of right now is just going to the gym.
I mean, that's a great thing. That's really, really good.
I
You
mean, I
just
have my husband to talk to, but I would be open to talking to somebody.
okay.
That
All
would
right.
probably make me feel better. Because, like I said, I don't know if even if I do this, I don't know if the doctor's going to give me the medication.
Right, right.
He might sit down and revisit with me, but I'm not sure
Hmm.
what direction, he wants to go with that.
Right. So he's giving you about 4 weeks to try to maybe make some
I
changes,
think
he
he
said.
said 6, 8 weeks he wants to
Nice.
revisit with me.
Okay, okay. So that's hard to still kind of manage that anxiety for 6 to 8 weeks on your
Yeah, I think
own.
that's why he shipped me over to talk to you because
Hmm.
maybe you could set me up. He was thinking
Hmm.
like talking about the drinking thing and maybe, um, checking in with me to see why, like you said, why I'm feeling the way I'm feeling and getting me
Right.
some extra help or something.
Okay, awesome. So you have a lot of anxiety in the morning. You talk to the doctor about medication and what you would really like that medication, but the doctor asked you to try to make some changes in your life before you took the anti-anxiety medication. And you've told me that it's very possible that you might be able to get back to the gym, which you had stopped doing since COVID started, so over 3 years. And then also maybe being open to talking to someone.
Hmm.
Okay, that sounds really great. All right, so there is someone that's in the clinic here that would be able to help you possibly learn some new coping skills for anxiety. I feel like that would be really hard for you to carry on and not have someone to talk to about the anxiety because he's not giving you the medication right now.
Yeah, and then just trying to cut back on my drinking. I don't know, and when I do that, how's that going to affect me? If I cut back on my drinking, is that going to increase my anxiety? So if I have someone to
Mm.
talk to, maybe the things I'm feeling, if that were to happen, that person can say, yes, that's what happens when you usually do that, or, um, you know, try to help me out along those lines.
Right. So you're concerned about when you cut back on the drinking that you'll actually feel more anxious
Yeah,
and you won't know how to deal with that.
yeah.
Okay, that's very insightful. So I can understand that. I can see that that would be really hard for you,
Mm-hmm.
and that the alcohol's helped calm you and helped you as a way to reduce stress in your
Mm-hmm.
life. Okay. So one of the things that might be helpful is to meet with someone at least once a week. They once or twice, 1 to 2 times per month. They usually once a week, maybe every 2 weeks, depending on your schedule. And maybe they could work with you and help you learn some alternative coping skills for the anxiety so that it's not so overwhelming for you.
Mm-hmm.
Because I know that would be really hard and you're really concerned about how you're going to react, how anxious you're going to feel when you're not drinking alcohol. And do you feel as though if you're able to have some support for the anxiety, that you might be able to cope a little bit better by cutting back on the alcohol? Cope
Yeah,
with that?
that's what
Yeah,
I'm hoping. That's,
I can see that would be really hard. Yeah, I to kind of be concerned about how you're going to feel when you cut back on the alcohol.
mm-hmm.
Now there's no doubt that you're telling me that the alcohol is helping you calm yourself and deal with the anxiety. So I can see how you're really concerned about that.
Mm-hmm.
Okay. All right. So I can talk to someone here and have them call you to schedule. I can have the doctor put in a referral for one of the counselors here to talk to you.
Yeah, and then he said 6 to 8 weeks, so I don't know if you could talk to the doctor and maybe revisit sooner than that.
Hmm.
Like you said, the 4 weeks. I think that sounds better.
Yeah, yeah. You said you're really concerned about
Yeah,
how you're
instead
going
of
to
waiting.
manage
Yeah, instead of waiting.
because that's almost 2 months.
Yeah.
Okay.
So at least if it's 4 weeks, I'm being held accountable to make sure. Oh, did you go to the gym?
Hmm.
Um, Maybe this person could meet with me once a week or something.
Yeah. Yeah, I think that you probably really need that right now. That would really help you kind of manage until you can get in and talk to the doctor and see if he can get you any medication for that.
Yeah.
Okay, he might be willing to do that. The best bet is to start with the therapy, talk to the counselor, go 2 or 3 times, and then maybe after 4 weeks you can call and see if they'll let you come in and make an appointment to see the doctor.
Mhm.
Okay, good. Okay. So, anything else that you would like to tell me about how that anxiety's kind of been impacting you? How do you
Um,
feel about
I
that?
can feel my temper. I'm
Oh,
I'm shorter. Well,
irritable?
yeah, irritable, and my patience isn't what it used to be.
Oh,
So I could see me being more irritable towards my children.
give me an example of how that
Just
might
trying to
show.
get them ready in the morning.
Mm,
Trying to get everybody on the schedule, eat your food, get your homework done, make sure you have everything in your backpack, and um, you know, it that could be challenging. So,
yeah,
um, traffic has increased, so I can see me, I don't have road rage, but I get to see, my patience isn't where it used to be.
so you're feeling annoyed.
Yeah, annoyed.
Okay. And what about your work? How's it impacting your work during the day?
Thankfully, I'm able to get my work done because I don't work with a whole lot of people.
Okay.
So I think if I probably had more coworkers and dealing with everybody with all their, I have bosses. I just don't have a lot of people in the office that
Right.
I have to deal with. So luckily, my work environment is, I just have to make sure that I get all the paperwork done because they have contracts with different companies.
Hmm.
So I have to make sure that those are all done and everything because I have a couple bosses I have to deal with. But
Oh,
luckily, that's kind of been going okay. But sometimes when you have these time constraints on trying to get certain things done, that's when, my anxiety at work kind of comes into play. But it doesn't happen very often. It's more or less with the home life, kids, the homework, the household, grocery shopping, dinner, and then like I said, I felt like I was losing time for myself.
Yeah.
So,
Yeah, it does sound like you don't have a lot of time for yourself, and that maybe scheduling some time for
so I think
yourself.
I'll probably talk to my husband now that
Yeah.
we have some kind of a schedule set, is or a plan or a goal
Yes.
that I can talk to somebody. So I'm gonna talk with him and saying this is what was recommended to me, and I hope you can support me because I need to do this.
Right. So one of the things that you're telling me is that you're distracted during the day and you seem to get through the day okay, but when you get home you start to feel overwhelmed.
Yeah, and then
And
in the
yeah.
morning time when I wake up, I feel like that is on the horizon. Like I already feel my anxiety because I
Yeah.
know what the day has to bring.
So you feel anxious in the morning when you get up.
Yeah, yeah,
And that's difficult. And then when you get to work you're kind of
yeah. So
distracted.
again, I'm anxious in the morning. I'm irritable. I'm annoyed. My patience isn't what you know, uh, isn't what it used to be.
Mm-hmm.
The weekends, like I said, they're not as stressful. But it just seems like it's during the week.
Okay, and I can see why. You're trying to work your full time job, you're taking care of the family, you're preparing meals, you're doing chores, and sometimes but when you get home, by the time your day's over in the evening, you're pretty overwhelmed.
Yeah.
And the drinking's been helping with that.
Mhm.
Okay, so if you take away a couple of nights per week to go to the gym, that exercise might actually help you work out some of the stress and anxiety. It's a way for our bodies to like release stress and strain of the day, and that you might find that super helpful when you go back to the gym. You've been to the gym before. Did you have a good experience when you were there before?
Yeah.
You had enough energy, you felt good, and you're
Mhm.
still able to get your stuff done at home.
Mhm.
So you worked it into your schedule, and then when it got out of the habit,
Yeah,
you
that's what it
just,
was. It was worked into my schedule,
yeah,
and then when somebody takes it and turns it upside down, and you have to, then you lose that, and then because I didn't carry that on to my daily life at home. I don't have a spin cycle or any of those
right,
classes,
right.
and a lot of those instructors they didn't have any way to reach out to anybody to say, "Oh, look me up on YouTube. I'm doing this or that," because it kind of just it kind of just everything
It
shut
went to the
down.
wayside.
Yeah, so that became a daily thing. Oh, me not going to the gym anymore.
Yeah.
So, and then like I said, it was just trying to deal with everything. It was like, a merry-go-round that just never wanted to stop.
So you felt pretty confident, about a 6 or 7, that you're able to get back to the gym. And knowing that going to the gym will actually help you de stress and work some of the anxiety out of your body, then that would be like a really good goal to start with. So we said start with 2 days per week, maybe Tuesday and Thursdays, whatever nights the classes are being held. You said you thought maybe they're Tuesday and Thursday, and getting back to the gym maybe from 7 to 8:30. It's only about an hour by the time you get there, have the class, and get back.
Hmm.
And then when you get back in the evening, would you be able to abstain from the alcohol?
I think so.
Okay, so you'd be late enough in the evening that,
Yeah, because I would stop my drinking about 7, 8 o'clock because dinner was usually about 5, 5:30. I start preparing things at 4:30.
oh, okay, pretty
So
early.
I try to keep the dinners early because kids have their homework and stuff. So I wasn't really drinking past 8:30 at night anyway.
What time are you going to bed? Or
I
what?
usually go to bed about 9:30, 10.
Mm, okay, okay, so you got a little
Yeah,
bit of
I
time to
wasn't
yourself.
drinking right up to like before I brushed my teeth at night. So
Okay,
um
okay,
yeah, I kind of stopped probably about an hour before I went to bed.
okay, all right, great. That sounds like a really good plan. All right, so let's just kind of summarize. You feel as though you would like to cut back on the drinking, and the way that you have thought about doing that is possibly going back to the gym 2 nights per week, Tuesday and Thursday, for about an hour for the class and a little bit of time before and after to get ready and changed and stuff. And then when you get back in the evening, you might not, you'll abstain from the alcohol in the evening.
Mm-hmm.
So that gives you 2 nights that you may not be drinking at all during that week. And then if we build this goal and we kind of, you feel really good about that, in addition to that, you're going to come and see a counselor and maybe talk once a week to a counselor and learn some other skills to help you manage.
Yeah, I'd like to at least talk to a counselor and then
Yeah.
have that person decide how, you know, when I should come in. If that person
Yes.
recommends once a week or once every 2 weeks.
Yes, perfect. Okay.
And then revisit with the doctor in 4 weeks instead of 6 to 8 weeks.
Well, you've really made some wonderful goals. I'm really proud of you. Just kind of trying to manage how you would change your drinking and cut back. That's really huge. I think that's really great. And then I know you need the extra support, so maybe talking to your family, especially your husband, and kind of telling them, hey, I'd like to go back to the gym and try to reestablish that habit so that I can not be drinking on those nights, and just
Mm-hmm.
kind of talking to him about that. So I'm sure you said he'd be supportive.
Mm-hmm.
Okay. All right. So I will have the doctor put in a referral for the counseling. Do you have any questions or concerns for me right now?
No, I'll just be waiting to hear from someone to find out what my next step will be
Okay.
as
Well,
far as having someone reach out to me to
yeah.
schedule something.
Well, I really appreciate the time you took to talk to me. Um, and I thought we had a really good conversation. I want you to think about things we said, and then I will have the doctor put in the referral, and they'll contact you and set up an appointment.
Okay.
Great. Thanks so
All
much.
right. Thank you,
Bye bye,
Laura.
Carol.
Bye-bye.